Hello, we are Term 4 nursing students here at Winona State, and we'll be going over brief information about COVID and provided education. For campus guidelines and protocols, WSU requires all staff, faculty, and students to wear a mask in all public indoor spaces in both Winona and Rochester. This also includes outdoors when unable to maintain a safe 6 feet distance. This applies to everyone regardless of vaccination status. And this protocol will remain in effect for the first few weeks of school. Although WSU is not mandating the COVID vaccine for all students, starting October 4th, proof of vaccination will be required for certain student populations. These groups include students living in resident facilities, students participating in intercollegiate athletics, and students involved in their clinical or internship sites. Students who choose not to get vaccinated will have to submit a COVID test at least once a week. Other guidelines include keeping that 6 feet distance between you and others and washing your hands. WSU also asks that you stay home and do not come to campus if you're experiencing signs and symptoms, been in contact with a confirmed case, or have a positive COVID test. If you are feeling ill or have been exposed, the university asks that you make an appointment for a COVID-19 test and complete a self-report, which will be explained later in the presentation. University leaders are monitoring the situation and will adjust requirements as needed.
To slow the spread of COVID-19, the Minnesota Department of Health and the CDC have recommendations to follow to protect yourself and others. One of the best things you can do to prevent getting or spreading COVID is by getting vaccinated. If you are not vaccinated, they recommend keeping a 6 feet between others and wearing a mask. Wash your hands often for at least 20 seconds and quarantine if you have been exposed to COVID-19. Fully vaccinated people may not need to quarantine in many situations. Stay home if you are sick and cover your cough and clean and disinfect surfaces.
So Winona State strongly encourages students and faculty to report any signs of illness that an individual may be experiencing. And you can do this by going on the Winona State website. So self-reporting signs of illness can ensure the safety of all students and faculty during this time. And Winona State website has the link to a short survey that you can fill out to report your symptoms or concern of infection. And it shows on the pictures on the slide where you can find that.
So Winona State University also strongly encourages you to report if you've been vaccinated. This helps the university keep track of the percentage of students that have been vaccinated and influences the university decisions. Additionally, like someone said earlier, if you are involved in internships, clinical, sports, or live in the residence halls, you must get the vaccination and report it. And similar to what Abby was saying, to report that you've been vaccinated, you can go to www.winona.edu/COVID, and it will bring you to the university's webpage and a survey where you can report that.
Ask a Nurse is a hotline service that you can call, and it's available to all WSU students. The service is free, it's confidential, and it's available Monday through Friday during the regular hours of health services. But if you call after those hours, they'll get back to you right away in the morning. And Ask a Nurse message line is here to answer any health-related questions that you have. And these can be questions about COVID-19. And these can also be questions that are completely different from COVID. So if you're not sure if you should see a doctor when you're feeling sick, tips and advice on how to care for yourself when you're feeling sick so you can get better, questions about quarantine or isolation if you're not sure how long you should quarantine for or if you have to isolate, and also questions about birth control and sexual health. Ask a Nurse is here to give you health advice, and they can also help you set up an appointment at health services if you call them and they decide that you should come in.
So one topic that we did want to discuss with you all is what exactly variants are, given that we're talking so much in the media these days and just face-to-face about Delta variant and just all these other COVID variants. So in simple terms, variants are mutations of a virus that occur when a virus enters into a person's body. After it enters into a person's body, this virus tends to duplicate in order to make you sick. However, every once in a while, mistakes occur in this duplication process, which then causes a mutation called a variant. Now, these variants make it easier for a virus to spread and harder for us to treat, even when a patient has been or a person has been vaccinated.
So that leads us to the Delta variant. So currently the Delta variant is the predominant variant as it is more infectious and leads to increased transmissibility when compared with other variants, even in some vaccinated individuals. The Delta variant causes more infections and spreads faster than early forms of SARS-CoV-2, the virus that causes COVID-19, which of course means that it is highly contagious. Some data suggest that the Delta variant might cause more severe illness than previous variants in unvaccinated individuals. In 2 different studies from Canada and Scotland, patients infected with the Delta variant were more likely to be hospitalized than patients infected with Alpha, or the original virus that causes COVID-19. Even so, the vast majority of hospitalizations and death caused by COVID-19 are in unvaccinated people.
Next, we would like to talk about how being vaccinated can reduce your risk of getting COVID-19. So vaccines build up the immune system to reduce the risk of being infected with infectious diseases. And the risk for fully vaccinated individuals is actually 91% lower than non-vaccinated or partially vaccinated. And lastly, if you are fully vaccinated and do have the chance of getting COVID-19, you will have a much milder and shorter infection course, along with lower transmission rates. And lastly, we'll just discuss what the pandemic has taught us. So there are a few main points here. So the first one is that one person can affect the health of the entire population. So it is very important to stay home if feeling sick. Viruses like COVID-19 affect everyone completely differently and can be fatal to many. Proactive mask wearing, social distancing, and staying home when sick are simple and effective actions to reduce infection rates. Make sure to wash, sanitize, and disinfect often to reduce your risk. And lastly, pandemics not only affect physical health, but also mental health. So please practice self-care often.